Men are known for bottling up things, and this is our point of departure today on Wanja's Health Diary. When you try to go it alone, then it increases the risk of anxiety, which may lead to depression and other mental health conditions. So today on Wanja's Health Diary, we'll talk about men and mental health, a condition that many of us don't want to talk about it, but the reality in society today is that men too need help. Karibu sana to Wanja's Health Diary.
Thank you.
Please introduce yourself and tell us why you have a particular passion for men and mental health.
My name is Edwin, and I'm a mental health advocate. And one of the reasons why I got into this space is I have gone through my own share of mental health struggles, depression, anxiety, severe ADHD, and I'm also a recovering alcoholic.
Let's talk about men in particular. Why do you think they need a special focus to address their mental health issues?
First, there is this misconception that men do not talk, or men, keep quiet so much. But I think men do reach out, but at times to the wrong people. So, because if you look at the statistics that we have, like for when you take a case like suicide, 800,000 people die of suicide every year. 510 of those people are men.
Which means then more men are more prone.
Yes, but the interesting factor, if you read on more, you find that women attempt suicide more than men. But now the catch is the methods which men use to take their own lives are more extreme. You get? So men actually do reach out, and that is why I'm saying this. Men do reach out, but at times they reach out to the wrong people. You get? And that has always been an issue to find out where or who you can trust with whatever you have that is burdening you. And even for me, that was a case.
So interestingly, you've brought in an issue about access to treatment and to management. And as you said, suicide ideation is one thing. Whom you reach out to is another factor. So what are some of the barriers that you would think, discouragement from actually getting assistance?
First of all, we don't have a very robust system when it comes to mental health and even health generally in Kenya. So that is one thing. And that I think people in advocacy are getting onto that space where they are getting into policy. So we are trying to get so much involved into policy so that whatever our views are and whatever our ideas are on what should be included or what should be done in regards to that we are taken more seriously. Now there's also the issue of stigma. And this is one big issue because you can have very good healthcare systems, but if there is a lot of stigma that is coming either from society or even internalized stigma, that is self-stigma, you stigmatize yourself in a way, that will also basically reduce your chances of you getting treated. So those are some of the two things that come on that are on top of my mind when it comes to access to quality care and stigma.
Interesting. And also there's this risk factor that our men are about 2 or 3 times more likely to misuse drugs than women. What is the contribution of drugs to mental illness?
Well, drugs do play a very big role in that because first of all, men are more prone to try and experiment than women. And also accessibility. Some of the drugs that we are talking about, especially in Kenya, they are very easily accessible. So we are talking about weed, we are talking about alcohol and all that. They are easily accessible. So you find that most men will fall into experimentation because some of these issues are also maybe genetically predisposed. So if your family has a history of mental illness and you get into drugs, then definitely your chances of developing issues are greatly increased.
Increased.
Yeah.